Knowing you're about to have twins can be overwhelming, but imagine learning one baby is taking more nutrients from the other and putting both lives at risk while still in utero.
This is called Twin-to-Twin Transfusion Syndrome. And while rare, there are not many options to treat it in advanced stages until now.
Senior health correspondent Monica Robbins explains why University Hospitals is now offering a procedure that may be the only chance to save lives.
In 2022, Tierra and Justin Koch were ready to give daughter Aria a sibling. Not long into 2023, they were on their way, pregnant, and surprise, it was twin boys. But their joy would come with worry, too.
And then we found out that they were monodied twins, meaning they have separate sacs, but they share a placenta. And that made us high risk.
At an 18-week appointment, the news was even more serious. The Koch's babies had twin-to-twin transfusion syndrome, a rare condition in which they shared a placenta but had an unequal ratio of blood.
It's just vascular connections in the placenta that are unbalanced, that one baby takes more nutrition and more blood flow than the other baby.
Twin-to-twin is a progressive condition and can often worsen as pregnancy advances.
Both babies develop heart failure, and ultimately it results in loss of one or both babies. And because those babies are connected with vascular connections, if one baby passes, unfortunately it can have catastrophic neurologic complications for the baby that survives.
Some cases do resolve on their own, but others can worsen rapidly, as was the case for the Kochs, who turned to Dr. Giancarlo Mari at University Hospitals for a procedure called fetoscopic laser surgery.
And he was one of the pioneer doctors that helped grow this practice. So it kind of gave us the ease of mind that we made the right choice.
Despite his more than 2 decades of experience, Dr. Mari counsels patients to seek a second opinion because this surgery is considered a last resort in advanced cases like the Kochs.
Because we want to make sure that when the patient decides to stay with us, it's very important that she understands, and actually the couple understands that yes, things can go well, but there is always a risk.
He told us about the laser surgery, and he said either you do this and we could potentially save one or both babies, or you don't get it and you would potentially lose both of them.
At just over 18 weeks, the Kochs left their home in New York and headed to Cleveland for the minimally invasive procedure. They had already named the boys Liam and Levi.
So we basically separate those vessels within the placenta to create 2 placentas, essentially, so those babies can't take nutrition from each other.
The surgery saved baby Levi. Sadly, it could not do the same for Liam, who passed away 24 hours later. While several centers around the country offer fetoscopic laser surgery, UH is the first in Northeast Ohio.
So you're not seeing it too often, thankfully, but when you do see it, it's nice to have this option here for the patients.
A bittersweet outcome for the Kochs, who grieved the loss of Liam, but were grateful for the procedure, especially as they welcome Levi at 29 weeks. He would spend 71 days in the NICU, but today is thriving at home under the loving care of his parents and big sister. But the Kochs say a return trip to Ohio is in the works.
We're actually planning to return, hopefully this summer, to the hospital in Cleveland and have Levi meet the staff that saved his life.
Monica Robbins, 3 News.
And the Kochs were among the first 5 cases performed at University Hospital.